This conference will now be recorded.
So welcome everyone to today's presentation by Paradigm Medical on the vital role of specialty footwear in lower limb lymphedema management. Lymphedema footwear is such a critical topic. We are constantly hearing about the challenges healthcare professionals and patients face due to the lack of education and access, making it difficult for individuals to truly improve their health. That's why we're so excited to have you all here today. My name is Jennifer Wang, and I'm the president of Paradigm Medical. For the last 3 decades, we've been a leading provider of medical solutions specializing in lymphedema, post-mastectomy, and orthopedic footwear and foot care products. You might know us best as the exclusive Canadian distributor of biocompression systems, lymphedema pumps, or our comprehensive range of lymphedema footwear and truncal compression garments. We're deeply committed to empowering healthcare professionals like you. So thank you for your unwavering dedication to improving patient care. So today, your presenters are myself and Franz Foster. She's a trainer with us at Paradigm and has over 25 years of experience in orthotic, prosthetic, mastectomy, and pressure care. Franz, do you want to give everyone a little shout out?
Of course. Hello, everyone. Thank you so much for taking the time to be here today.
So just a few little go-to webinar function before we get started. Please mute your devices and turn off any cameras just to minimize any disruption to everyone during the presentation. And as well, if you do have any questions, Franz and I love questions. We think it's so important. Please use the chat function. It's a little bit of a dialogue box to ask your questions. Franz and I will be monitoring it, so we'll be sure to make sure that your questions get answered. Well, let's get started. So the goal and agenda for today is to help understand how lymphedema impacts mobility, independence, and quality of life, and seeking the appropriate solutions to improve patient life outcomes and care. So today's topics will be just a high-level overview of what is lymphedema, the importance of comprehensive lymphedema management, the impact of inadequate footwear, what are the benefits of specialty lymphedema footwear, and some practical considerations. We'll open it up to Q&A at the end of the presentation. But if you do have questions throughout, feel free to use the chat function too as well. And with that, I will pass it to you, Franz.
Thank you, Jennifer. Okay, so the first thing that we're going to look at is what is lymphedema. We're just doing a quick, very high-level overview of what lymphedema is, and for those that are not familiar with it. So lymphedema refers to tissue swelling caused by an accumulation of protein-rich fluid that usually it gets drained through the body's lymphatic system. But if the system is impaired, obviously the accumulation remains and cannot be eliminated. It most commonly affects the arms or the legs, but can also occur in the chest wall, abdomen, neck, and genitals. The lymph nodes are super important to the lymphatic system. And so when this protein-rich fluid accumulates in the interstitium, which is the layers between the skin, this fluid fills the spaces in the body. Now, this condition is chronic, progressive, and does not have a cure. Let's do a little comparison of what lymphedema is versus edema. So lymphedema is swelling caused by that excess protein-rich lymph fluid that is trapped within the tissues. As I said, it is a chronic condition. Its onset is usually slow. It is not symmetrical. It can occur unilaterally or bilaterally. It can show signs of pitting that displaces with difficulty. So the skin has like the appearance of the skin of an orange, essentially. Or it can have no pitting at all, but the skin will usually become thick and brawny. Now, comparatively, edema is usually caused by excess tissue fluid that has not yet returned to the circulatory system. It usually occurs rapidly, bilaterally, it's usually symmetrical. There can be weeping or clear fluids coming through the pores that could blister. And it also has deep pitting is also possible. And it usually has like a shiny skin appearance. So when the body can no longer remove this excess fluid after a certain period of time, it becomes lymphedema. So let's talk about what is lymphedema. Sorry, I'm just reading the title here. So we're talking about prevalence here. So this is the latest statistics that came out in October 2024. And so the prevalence of lymphedema is around 3% within the Canadian population, which is a huge number, 1.25 million Canadians that suffer from this chronic and uncurable condition. The edema percentage is actually unknown. So there's the lymphedema aspect, but there's also the edema aspect, which the edema aspect is very difficult to judge because it's considered to be much higher because anyone can be affected and many people actually remain undiagnosed from this. And a good majority of the causes are from obesity, cancer, disabilities, and surgeries when it comes to lymphedema. I'm just going to touch on that on the next slide a little bit.
We were talking about the prominent causative factors related to lymphedema. So Franz had mentioned chronic obesity. That represents roughly 690,000 cases out of the 1.25 estimate. Further, there's cancer-related lymphedema, which is estimated at around 350,000. That's about half of what the obesity-related factors are. So these are the top kind of two buckets in terms of causes. How is lymphedema diagnosed? So typically swelling is present for in excess of 3 months. One of the tests that's performed is that patients, when they elevate their limbs, it's not responsive, meaning that the swelling doesn't go down with limb elevation or diuretics, medication to help remove fluid from the body. There also could be low levels of chronic inflammation causing tissue damage, or the stemmer signs, which if you look to the right there, there's a little image of what we're referring to. This is a positive stemmer sign. When you see that when they're pinching the skin there at the base of the second toe on the left and the base of the middle finger on the right. Further, in terms of lymphedema, there's generally 4 stages. So stage 0, that's the latent or subclinical stage, and that's the image the furthest to your left. At this stage, the patient may feel a little tight or heavy. However, It doesn't appear, swelling doesn't typically appear at this stage. It can be very subtle, hard to really tell that any swelling is present. Stage 1, which is the second image from your left, is the early or mild stage. Some swelling is starting to present itself. However, the swelling will return to normal once the limb has been elevated. So stage 2, that's the third image from the left, where you're starting to see changes in the skin. This is a moderate stage. This is where swelling is very present. The limb is swollen most of the time. The skin is starting to feel very rigid, more rigid than in other areas of the body. The skin may thicken, and there is a persistent edema, and elevation does not reduce the level of swelling that is persistent there. And lastly, we've got, stage 3, which is the most severe stage. This is very large. The limb is, as you can see on the image, the fourth image from your left. This is a very complicated stage. The swelling is very, very pronounced. There is skin changes. There may be other skin deformities such as wart-like growth, small blisters, or fistulas, which contain lymph fluids and may discharge. This is why lymphedema patients at this stage, typically it's very important to have good skin hygiene because infections can be common.
Well, I am back.
Yay! I'm glad you were able to sort that out. But I just presented for you the past couple slides just because I'm familiar with this topic. But if you can join us from there, I'll pass it back to you, Franz.
Absolutely. Thank you so much. All right, so now let's talk about the impact that it can have on people that have lower limb issues and other challenges that are faced by patients when they have lymphedema. So things that they will face is excessive swelling, having sensitive, dry, and tight skin, which can also be very painful. It puts them at a higher risk of infections because that liquid is pooling inside the limb and is not able to be excreted out of the body. So this stagnant liquid can easily get infected if you get a scrape, a scratch, or even just from sitting there. So can also be very dangerous. They will have to wear wraps or bandages or compression garments. They will feel obviously limb heaviness, which means that their mobility is affected. So reduced mobility or very limited mobility, a lot of discomfort and pain. It can definitely impair their balance because of that excess weight that they are carrying around. And it makes it very, very difficult for them to find appropriate, adjustable, breathable footwear that will accommodate that anatomy. Now, when we talk about, so this is about the importance of comprehensive lymphedema management. So the encompassing way to treat lymphedema it's called a multifaceted approach or complete decongestive physiotherapy or therapy. So it includes many different aspects. So it includes manual lymphatic drainage, which is a very specific of manual massaging, It's not like your typical deep tissue massage at all. It's completely different from that. Meticulously taking care of the skin. So that has to be part of the regular regime. Doing exercises to keep the body moving. Because when we become inactive, that just makes that fluid sit there even more and stay there even longer. So exercising while bandaged is crucial. Using static compression garments, so any type of garment that will apply compression and keep that from getting worse. And then using pneumatic compression devices such as the biocompression pumps. So all of those. So treating lymphedema is a multifaceted approach. Footwear is a critical component and it is often overlooked. So lymphedema patients should wear supportive footwear at all times. This helps to protect their feet, to keep them mobile, keep their feet protected from scratches and a bunch of different things. So just from injuries, etc. So when they are walking anywhere, whether indoors, outdoors, on the beach, in the snow, swimming, shopping, etc., they should, not swimming, shopping, they should definitely wear something on their feet. So it's really, really a critical component to their managing their lymphedema. So just a quick overview of what qualifies as an orthopedic lymphedema footwear. So the products that we're presenting today are Class 1 medical devices, as stated by Health Canada. So there may be insurance available in your province, so you would have to look into that. We will have a little bit of information about this. So Alberta's AADL program does offer some coverage. Now, other provinces may also offer coverage for specific conditions. So if it's, due to, I'm just throwing an example out there, maybe they have venous insufficiency or something, which is causing lymphedema, etc. So those types of specific conditions could allow them to get a pair of lymphedema shoes. You should also have your patient check with their private insurance to see if they have any type of coverage for that. Lymphedema shoes are a zero tax item because they are a medical device. And if there's any balance that isn't covered by any of the above, or they can actually submit that to income tax or submit the full amount to the income tax. And it is the prescription is required to get that coverage. And now I will hand this off to Jennifer.
Thank you, Franz.
You're welcome.
So let's review what the impact of improper footwear. So feet have a highly, highly important function. It's the foundation of the human body, and it carries us through life. So taking care of your feet and making sure that you have good supportive footwear is so important, because the body is very complex. And when there's any type of imbalance, especially in the feet, because all of your body's weight is being carried by the feet, it can present in a lot of different ways. So even mild foot conditions can have a very significant impact on the quality of life. So it's important to be wearing the proper kinds of footwear. Otherwise, the wrong footwear can lead to improper support, very poor foot health, and other medical conditions. You often hear about foot pain, knee, ankle, hip, back, even it can impact neck pain. So the most like first step is to get proper footwear, and there's a lot of economical and easy ways to go about doing that. Having proper socks is very important too, because if you don't have proper footwear and proper socks, um, uh, any type of discomfort can lead to greater issues down the road. So some common foot challenges faced by lymphedema patients. As we discussed, there's a lot of swelling and then volume fluctuations. So the swelling can change from month to month, week to week, even daily during the morning time versus the evening time. So that's one of the biggest challenges, where you need footwear that's adjustable to be able to accommodate that. As well as we spoke to earlier, increased risk of skin breakdown and infections, which is very common. So we need footwear that's washable, that we can sanitize on a regular basis to try and minimize infections. Other challenges include difficulty finding comfortable and supportive footwear. Because the foot is so swollen, many times patients can't find footwear that is wide enough and deep enough, and that has the girth that they need to be able to support all that additional volume in the foot and in the ankle area. Um, Another issue is that there could be significant variations from the left and right foot. So you need footwear that's very adjustable to be able to accommodate the different sizes and daily changes too as well. So when patients have improper footwear, it can lead to a very vicious cycle of inactivity, meaning they're just not moving. So if you don't have good footwear, you're not moving, you're not getting out of the house, you're not exercising because it's just too painful to walk around barefoot, or you're ashamed because you don't have the proper footwear to leave the house in a presentable manner. It just becomes a very vicious cycle, um, creating loss of muscle strength, decreased lymphatic flow, deterioration of the cardiovascular system, increased fatigue. Um, the less they move, the less the lymphatic system works. So moving is key. And as Franz spoke to earlier, as a part of complete decongestive therapy, treatment for lymphedema, it's important to exercise. And you need good footwear in order to do that. Other consequences of ill-fitting footwear, or just not having footwear, could be increased pain and discomfort. The footwear, if it's not properly fitted to the patient's foot, can cause pains, sores, discomfort through the body. It will compromise mobility and the patient's independence to be able to leave the house and do sort of day-to-day activities and go to work. It'll also exacerbate the lymphedema symptoms, because they're not being active, they're not moving. Other impacts, and this is a big one, because we do see it a lot in lymphedema patients who have more complex situations, is this results in a huge psychological impact related to social isolations, because you don't have the right footwear. People don't leave the house. They don't get to see their friends. They don't go to work. They don't get to go see family. And that can result in a lot of mental health issues. So let's go on to reviewing some of the benefits of specialty lymphedema footwear. We'll talk about what the fundamentals are in terms of measuring and determining the proper size, because that's super, super important. You want to make sure that the shoes fit the patients properly and they're comfortable so that they want to wear them. What are some of the key features that you want to look out for when recommending lymphedema footwear to your patients? What are some of the customization and adaptability options, and how this goes about improving quality of life. So we will start with one of the most important aspects is proper sizing and how to go about measuring the foot. So there's three major measurements that are critical. This can't be stressed enough. We want to make sure that the patients are getting footwear that fits their unique measurements. So it's critical that the feet are properly measured and that they're fitted to the shoes. We also offer a shoe fitting guides that are available on our website. Or we also offer a very comprehensive foot orthopedic footwear and foot care fitter training program that's available so that you can get certified and become a certified orthopedic footwear and foot care fitter. But let's just review high level. So three measurements that are important: foot length, foot width, and the foot girth. We want to make sure some tips is to measure both the left and right foot, because they are unlikely to be the same. They're unlikely to be symmetrical. Most people, even people who do not present with lymphedema, have different size feet. There are small, slight variations. But with patients with lymphedema, it'll be even more pronounced. So you want to make sure that you're measuring both the right and left foot. You want to trace the foot a few times to ensure that you are taking accurate measurements. You want to make sure that the foot is laid flat and it's splaying out. It's not crumpled together, because sometimes our feet, because we've been wearing poor footwear for so long, our feet kind of bunch together. You want to make sure that the foot is fully flat. You might need to even press on it to get the toes kind of to splay out. You want to ensure that the patients are wearing what they would wear on a regular basis. So whether it be socks, compression garments, wraps, and bandages, whatever they would be wearing with the shoes, you want to make sure that those are worn while the measurements are being taken. And then in terms of tips for taking the foot length, you want to measure the heel from the heel of the foot to the longest toe. And that can vary from patient to patient. Some people have the big toe is their longest, some people the second. So it ranges, but you want to ensure that's to the longest toe. And so when we are looking at length, there's a couple different ways that you can go about taking the measurement. You can use a foot sizer, a shoe sizer, excuse me, such as a Brannick device. You probably commonly see these in shoe stores. Or you can, if you don't have that, simply trace the foot on a piece of paper. As I mentioned before, you want to measure the foot length from the base of the heel to the longest toe. Next, you want to look at taking measurements of the foot width. Feet come in all different shapes and sizes, as you can see here. not everyone has the width. You want to take it at the widest point, and not everyone's widest point is the same place. So you want to make sure that you are mindful for that. Different people, the widest point on their foot can be in different places. So it's important to make sure that you measure according to the widest area. Otherwise, the foot's going to be bunched in the shoe, which will make it uncomfortable, and they're not going to want to wear it. And then lastly, this is a very important measurement for people who have excessive swelling in the foot. It's the foot girth. And you can think of it as more of like the circumference. So for any type of swelling in the foot, it's important to take the waist girth measurement. And that's that measurement just behind the ball of the foot here in the diagram. This is a circumference measurement, and you take it by wrapping the measuring tape around the foot. And this measurement helps determine the overall volume and fit of the footwear. You typically don't see, for regular shoe stores, you might not see them take this measurement because the foot generally is, in a healthy, normal foot, it's flatter. But in lymphedema patients, because of the extreme excess swelling, there's much more volume to the foot, and the circumference of the foot can be a lot larger. So it's important that we take a measurement for that. So that is just a high-level overview of what are some of the important measurements that we need to take when we are trying to properly size for lymphedema footwear. If you're interested in learning more, we have sizing guides on our website, and we do have a formal fitter training program for the footwear. Please also be mindful that each brand manufacturer of footwear use their own unique sizing guide. It is completely different from manufacturer to manufacturer, from factory to factory. So it's very important to take each patient's measurement, and that could change on a month-to-month, daily basis. So you want to make sure you get the most current measurements, and you want to take both right and left foot. And then use the manufacturer's, the brand's size guide to determine which sides to purchase for the patient. So now let's move on to some of the benefits. So key features of effective lymphedema footwear. Because of the changes in the volume and the swelling could be in different areas of the foot, it's very, very important to have adjustable closures. And this includes, as you can see on that Pudor's Max shoe, very long Velcro straps, so that you can adjust the size, or footwear such as the Podewell on the right, that blue shoe where you can open fully to accommodate swelling, volume changes, and patients may also have difficulties putting the footwear on and taking it off, donning it off, on and off. So having an open closure like that can be helpful too as well. So other key features is to ensure that there's a wide toe box and a deep instep. So wide toe box, if you look on the left there, you see there's a very, very wide. It doesn't point at the front. We don't want that. We want it wide so that it can fully accommodate the foot, as the client is walking and moving. If it is tapered at the front or pointed at the front, then the foot will be bunched, and that will make it uncomfortable and potentially leading to other foot deformities, potential wounds, things of that sort, as it will be rubbing. So you want to make sure it's got a wide toe box because it could accommodate the foot fully splayed, and a deep inset step. And the depth, we've got that little image there on the right of the foot, that's the depth. Because as you can see how swollen that foot is, there's a lot more volume and circumference. So you want to be able to accommodate that. So this ensures that with these sort of features, you can ensure that the patient can easily put them on, comfortably splay their toes, and have a stable foundation to walk on. So one of the key features of lymphedema footwear is that it comes in multiple widths. And this is really critical and important because it allows you to accommodate the various levels of swelling. So as you can see here, the Pador shoes come in 6 widths. So on your left, you've got medium, BC. That's the normal kind of footwear that you'll find. That's the normal width. Then you've got wide, extra wide, extra, extra wide, triple XY, and then 5XY. So 5X being on the very extreme end. For people who are probably stage 3 lymphedema, will need footwear in the 5X range. So another key feature would be breathable and washable materials to help minimize any moisture and skin irritation. As we mentioned, people with lymphedema are more prone to infections. So we want to make sure that the footwear is very breathable so it can air out the foot. And then as well, minimize, if it's washable, you can keep it more clean and minimize infections, future infections. So many of the Padors and the Podewell shoes are machine washable. And why is that important? To minimize infections and to keep the footwear clean. It's very, very crucial.
Jennifer, we have a question.
Wonderful.
From Nipissing Pharmacy. So when wearing a specialty shoe, does it provide additional compression to the foot? If so, does the compression garment have to be modified in any way?
So that's a great question. And the answer is no. So the footwear doesn't provide any compression in terms of the sizing of the foot. The patient will need to wear. Okay, so step one. Sorry, I'm getting a little ahead of myself here. Step one. So the patient will be wearing their compression garments, any wraps or bandages, while wearing the shoes. So just want to clear that up. But there's no additional compression that's going to be provided by the shoe because the shoe is not going to be fitted to the point where it's tight on the foot. There is going to be a little bit of room for the foot to move as you're walking, as with normal shoes. There's a little bit of room because the foot is going to move a little bit, but not so much that it's going to be uncomfortable or it's going to cause irritation to the foot. Does that make sense? Did I clearly answer that? Please let me know.
I believe you did.
Okay, great. That was an excellent question. Okay, so some other customization and adaptability features. So we're just going to do a little comparison here of custom-made shoes because that's one option that's available for lymphedema patients is going down the custom route or the products that we're talking about today are all off the shelf. These are ready-made products. Some patients, if you have very extreme and unique and complex situations, um, then that custom-made option may be something that's recommended. But for many cases, off-the-shelf products are available in the Padors and Podewell brands, as these are specifically designed for patients with lymphedema and are mass produced. They're produced in larger quantities than one-off. They have standard sizings, but as you can see, lots and lots of different options. We've got the various different widths, and then we've also got size from size 3, I think, to up to size 17. So a lot of options available. So we can accommodate the various different foot sizes. This option, off-the-shelf options, tend to be more affordable because they are not made on a made-to-order basis, and they're readily available and easier to replace. Custom shoes, it could take a while to get them. It could take several months, and they're in the cost of about $2,000 to $5,000 a pair. And off-the-shelf footwear, depending upon um, uh, the features, could range in that 250 to 500 retail price. And lastly, another feature that's important to note when we're looking at orthopedic lymphedema footwear is that there are generally built-in inserts or a removable footbed. If you look at the images there, you can see that the insoles, inserts, there's a whole bunch of terms for it, but the images will help you understand what we're referring to. These are removable so that you can accommodate different foot sizes. You can accommodate, some people might need an orthotic, so you can put an orthotic in. These are very good for added support and fit of different size feet, or day-to-day changes in swelling. Many of the shoes also come with options to get additional inserts that can be removed or added to the shoe, so that you can help accommodate changes in volume from maybe one foot to the other, or it could be related to day-to-day changes. And they're also trimmable. So say, for example, the patient has a lot of swelling in the front of the foot, but not as much in the back. So you can add additional inserts to fill the volume gap by cutting the insert and adding it to the back of the shoe to help accommodate for that. So these tools and customization and adaptability options allow you as a fitter or the fitter to be able to make these little adjustments to the shoes so that they can accommodate the unique features and size of the patient.
Hi, Jennifer. So Nipissing, I just wanted to clarify that Nipissing had a second question, which
Great.
I believe I answered correctly, but the measurement, when you're taking the different measurements to assess what foot size they are, what type of shoe they should wear, should it be taken with bandages on or off?
It would be on. So if they are wearing the wraps and bandages, if they're required to be wearing them on a daily basis, then yes, you want to take it with it on, because otherwise your measurements will be too small, and the shoe size that you select will be too small. So you want to make sure that whatever they're going to be wearing on a regular basis, whether it be wraps, bandages, compression garments, special stockings. Some people like to put fun socks on top of the wraps and bandages. All of that needs to be on the foot when you're taking the measurement, so you actually know the proper size, because those can add a little, a few millimeters here and there, and that could change the size of the shoe that's needed.
Absolutely. And just a comment from this Nipissing as well, that it's very, very unfortunate that ADP doesn't cover footwear for those who do not have personal insurance.
Yeah, no, I agree with you. We gotta get on that. Let's all collectively work on that, because we've been pushing for it on our end, but we do need support from the community too as well. Um, because the larger the voice that we can present to them, the better, and the more likely they'll listen. So thank you for your great questions. That's a very important point. It's often overlooked too as well. So in summary, all these features, all these uh, benefits help to improve the quality of life of the patient. Most importantly, it'll enhance their comfort and allow them to be more mobile and get out and exercise. This helps to reduce the risk of any complications or the worsening of the condition. And then as well, it helps to improve, their confidence and their independence, and feel like they have control over it, and it's not controlling them, and they can continue to live their lives on a day-to-day basis with these tools. And with that, I'm going to pass it back to you, Franz.
Thank you so much. All right, so now let's talk about practical considerations for yourselves, retailers. Some of you could be health professionals as well. So those are just the different things that would be practical and important for you to know. So we're just going to quickly go over some of these things. Assessment and fitting techniques, which Jennifer covered very, very well today. Customization and adaptability, improved quality of life, any additional training programs by Paradigm, and insurance coverage. All right, firstly, so in terms of the assessment and fitting techniques, the fact that you have to have proper measurement and evaluation of the lower limb lymphedema is absolutely crucial. So the tips and tricks that she gave you about proper measuring is super important. So how to properly measure the feet and how to evaluate the lower limb lymphedema, and whether to take the measurements with bandages on rather than off, and the reasons why. The guidance on selecting appropriate footwear sizes and style, we're going to cover some of that footwear as well. And also, we've already offered lots of tips for fitting and adjusting footwear for optimal comfort and support. So the measurement and evaluation of the lower limb lymphedema, Jennifer's covered that really, really well, so I don't think we need to do anything further with that. And as Jennifer mentioned, we have comprehensive footwear measuring guides that are specific to the manufacturers, because their sizings are simply different. I mean, they go by certain specific parameters when they make their products, when they build the shoes, and or you can also take our educational training course, which is the Orthopedic Footwear and Foot Care Fitter Training course.
Oh, another tip to add is that not only do the manufacturers of the brands have different sizing parameters, the sizing parameters can also be different from style to style. So that's another aspect that you want to look at, because when the shoes are made, and I don't want to get too technical because I can go down a bit of a rabbit hole here. They use different lasts, so the footbed is different, so that could change the size of the foot, the sizing. So always take the foot measurement, the most recent foot measurement, and then compare it to the sizing charts of the manufacturer for the specific size and style that you're looking for.
Yes, very, very good point. Okay, next we're going to talk about different product recommendations and resources that are available to you. So we're going to go over some specialty lymphedema footwear brands and models, where to find reliable suppliers and manufacturers, and what resources are available for patient education and support. Not all footwear is necessarily lower limb lymphedema compliant, so you need to understand the difference. Pedors and Potawell are the go-to as far as this type of footwear is concerned. So Pedors is a highly recommended brand for lower limb lymphedema because of these very specific features that they have. So they are manufactured to be super lightweight, which is important for someone who has lymphedema, who has excess fluid and weight added to their limb, because they use EVA soles and canvas heels. They use touch closures, which allow easy adjustment as the feet swell throughout the day. They have removable insoles, which make it also orthotic friendly, so an off-the-shelf orthotic or custom orthotic can be used here. And of course, it helps to manage volume fluctuations. Another thing about Pedors is that many of their styles have a pediprene stretch upper. And this is a proprietary material that they've added to the upper of the shoes, and it actually is stretchable. So it's great for lymphedema, swollen feet, diabetes, bunions, and all sorts of forefoot problems. They also have a soft toe box, so it doesn't apply pressure to the affected foot. It's factory heat formed and seamless, and it's also a nice deep toe box. And also very important, they are machine washable, so they are warm, wash in warm water and air dry. So the ever popular Pedors Classic, very popular shoe, comes in 3 colors. It's a unisex shoe, so men and women both can use it. It has a single strap hook and loop closure. It's, again, extremely lightweight, which is a characteristic of Pedors shoes. It has a stretch no toe cap forefront that accommodates all kinds of forefoot abnormalities. And again, removable insert that allows for an off-the-shelf or custom orthotics. And also the pediprene material at the forefoot, which can be heat molded. It comes in with medium, wide, and extra wide. Now, the Classic Max. So when you have someone that requires even more width and more girth for their foot, the Pedors Classic Max is a shoe that features dual strap hook and loop closures. It has a cavernous opening for bandaged or swollen feet. Again, extremely lightweight. And also the same other characteristics as outlined before, with the stretch no toe cap forefront, the removable insert for custom or off-the-shelf orthotics, and the pediprene forefoot that can be heat molded. So the width for this particular style is 2E, 4E, and 6E. So offering lots of choices for anyone suffering with lots of swelling in their foot. There's also the classic slide. So this one doesn't have a back. It simply has well, as the name implies, it's a slide that you slide your foot inside. It's available in 6E, so in the upper range of the previous shoe that we just looked at, and designed for people with very swollen feet. It has a single wide adjustable strap that allows to adjust for girth, and also it helps to secure the slide to the foot. We don't want the foot to slide out, so it does allow to securely fasten the foot inside. And again, pediprene stretch upper, very lightweight, removable insole, single strap closure, extremely lightweight. And as far as washability, all of these are warm wash, air dry, but never put these shoes in a dryer.
And just to add, France, in terms of use cases for this this shoe, the slide, it's really great for at-home use when patients are walking around the home and they're looking for something that's really easy to get on and off. And also for clients who have mobility issues, we do see a lot of that where they have a very difficult time being able to get a full shoe on due to some kind of mobility issue. So these are great options so that they at least have something to wear. It's always best to be wearing a full shoe because that's where you get the best support. But in cases where that's not possible, this is a good option because then at least they have some kind of footwear that they can put on their foot easily that fits them properly. So they are able to leave the house and as well get the support and comfort they need while they're moving about.
Very good points to point out. Thank you so much. And then we have the Pedora Supermax. These are for the extreme cases. So this is a 5X or 10E wide shoe offering extreme width and stretch. It is a unisex shoe again. All the previous ones are all unisex styles. It features a dual strap hook and loop closure, a huge opening for bandaged or swollen feet. It's extremely lightweight and has all of the other same characteristics. So the stretch no toe cap forefront, removable insert, and pediprene forefoot that can be heat molded.
Yeah, this style is similar. It's pretty much the same as the Pedora's Max, only this one comes in the 10E 5X width, and this is the widest shoe that's on the market. You're not going to find anything wider than this unless you go into a custom shoe. But this meets the majority of needs of people with the latter stages, like stage 3 lymphedema. This or the Max would be the option when you're looking at that extreme amount of swelling.
Perfect. All right, now let's talk about the Podewell footwear. So this is a very well-known French company based in France who specializes in lymphedema footwear. All of their styles are extra large, so they, as far as width, so they have substantial fitting room to fit post-operative, diabetic, or seriously swollen feet. Again, removable insole, which enables the use of personalized orthotics, so custom or off-the-shelf orthotics. Sanitized treatment, so they use a material and a compound that limits the development of bacteria and odors even after washing. So it's something that stays within the shoe the whole time during wear. It has great comfort and less constraints for sensitive feet. They all have adjustable straps. Some of them open fully. And they're also all machine washable at 30 degrees Celsius maximum, and they dry very quickly. So we're just going to feature a few of these shoes, but there are more in the line. The Podewell Altitude is, as you can see, you can fully open this shoe. You have a a flap at the front and the back that can both go right flat down so that the shoe can easily, or the foot can easily be inserted into the shoe. It's machine washable, it's very comfortable, it's very lightweight, and that foot insertion is facilitated by that rear Velcro flap. It's available in the extra wide width. Podewell Donuts, also a very popular shoe, also very machine washable, comfortable, lightweight shoe, and it's quickly adjustable with of the instep area with that Velcro strap. Athos, another best-selling shoe, comes in 2 colors. It has quick double adjustment of instep with the 2 Velcro straps. So again, you can still open this quite wide in order to insert the foot inside. The Alexis has all of these characteristics. This one is an open toe, and again, you can fully open it. It's great for as a post-operative shoe, and the foot cover area has a large fitting area, and also, again, machine washable, comfortable, lightweight. Also in the extra wide width. So just a quick overview of all the different styles that we've mentioned here. So when you're dealing with patients that have mild to moderate lymphedema, so 0 to 1 type of lymphedema, the Pedor's Classic, any of the Podewell footwear are all a good choice. They're all machine washable. There is another footwear called Pedor's Stretch Walker, and it offers a lot of the same characteristics. The only thing is that because it's made of leather, it is not machine washable. So there's just that little differentiation there. And then when we get to the moderate to severe stages of lymphedema, the Classic Max, the Super Max, and the Slide are all machine washable. So those are ideal for those. So you have to make your selection based on the severity of the lymphedema as well. In terms of collaboration and communication with amongst yourselves, with other health professionals, with referral sources, the goal is here to provide enhanced patient care. And we can do this by using resources more efficiently, by working closely with referral sources, making connections within your community, which gives, in the end, better access to care for patients. And the demand for products and additional features can help drive innovation from manufacturers, but this comes from patients, retailers, and health professional feedback. So it's important to give this information to Paradigm and on to the manufacturers as well. Communication is so key in ensuring that the patients get the best care. And having said that, so the next slide is about a little brochure from Pedor's. Oh, I don't know if it went missing. So there is a brochure that you can get from Pedor's, and it just outlines a few of the. Oh, there we go. It outlines a few of the styles. So you can ask for this brochure. This is just the front of it. There are more information contained within that brochure. You can leave this with your referral sources to increase awareness about the availability of these types of shoes, and to increase communication and with the retailers, with patients, and with health professionals. And in the end, what you're doing is implementing best practices that are for the benefit of the patient. Now, when you are dealing with patients, you should use effective communication strategies to ensure patient satisfaction. So there are just a few things that we can recommend here. Active listening by fully focusing on the patient. Using clear and simple language, so using latent terms that can be easily understood by them. Showing empathy and compassion to their condition and their struggles. Being aware of your nonverbal communication, such as your posture, maintaining eye contact with the patient, and using technology effectively to enhance communication with patients, such as keeping track of their medical information, implementing their care plan, and doing follow-ups. So those are just a few tips for you. And now I will hand this back over to Jennifer.
Thank you, Franz. So just to review, we do offer a few additional training programs. I mentioned earlier about the orthopedic footwear and foot care fitter training program. We also offer one for mastectomy and truncal lymphedema garments, and then the pneumatic compression pump fitter training program. So we have 3 programs that are available. If any of you are interested in learning more or registering for one of these training sessions, please reach out to Mina at info@paradigmmed.com and we will get you signed up. And then lastly, insurance is always a conversation that people are interested to learn more. This is just a quick summary of coverage across Canada. It's very nuanced, so this is a very high level summary. It can be very specific to an area and the patient's unique situation, but in general, there is insurance coverage for orthopedic footwear or lymphedema footwear when it's with patients who've been diagnosed with lymphedema. The terminology is off the shelf, non-custom, orthopedic, and or therapeutic footwear. That's generally what you may hear from insurance companies. These are licensed by Health Canada as Class 1 medical devices. And as such, there is provincial health insurance through the AADL program in Alberta. There's also coverage, and this is whether it be private insurance or extended health benefits. This is very policy dependent, so ensure that the patient calls their insurance companies to learn more about what type of coverage is available. The coverage is for everyday footwear, for everyday use. And we do also offer an insurance letter for clients to be able to submit with their insurance claim to support the orthopedic features, which would be required for them to get insurance coverage. Further, because these are Class 1 medical devices, patients can use it as an income tax deduction on their tax returns to help offset any taxes that they may need to pay. As well, these are zero-rated medical devices, and what that means is if you do have a prescription, there will be no sales tax charged on the products. So to summarize, if a patient is interested in purchasing one of these products through insurance, a doctor's note is required to be able to access any of the above funding. And so in conclusion, some of the key takeaways, we're hoping that this presentation allowed everyone to really just better understand lymphedema, the importance of the comprehensive management, the benefits and the importance of specialty footwear as part of the comprehensive lymphedema management, and how this impacts your role as a retailer or a health professional, and what are some key takeaways for you in helping you implement some of these best practices for footwear assessing and fitting, and some tools for you, such as the Fedora's brochure, to help you promote collaboration amongst the community and your referral base, and continue ongoing education, because that's one of the biggest challenges, is people just not aware that these products are available, and the nuances, and how to go about properly fitting, and properly assessing people for these products. And now I will open it up to Q&A. No bad questions. All questions are great. And while we have everyone here together, it's always best just to get your questions addressed immediately. But if you do have anything that that maybe pops up later down the road while you're taking a shower or going for a walk, don't hesitate to reach out to us. Here's all our contact information. We're very happy to support you and your patients through this journey and getting you set up. We're always here to help. Okay, so we've got Cindy. Cindy has her hand up, so let me see if I can. Oh, Cindy, here we go. Cindy, I'm going to unmute you and go ahead. Let me see if I did that correctly.
Hi, can you hear me?
I can, Cindy, loud and clear.
Hi, so I work at Toronto General with the vascular surgeons, and we see a lot of patients with lymphedema. And so, what would the prescription need to say in order for them to get coverage?
So generally, the insurance, the patients would have, it's generally, what's the diagnosis? Like they have, I'll have to get you, in terms of specifics, it would be like, what's the condition and why do they they
Like,
recommend
is
orthopedic
it
footwear?
orthopedic footwear or therapeutic footwear?
Yeah.
Or
So either of those terms are effective. Orthopedic is more known, depending on which part of the country you're in. Sometimes they use different terms. But you're in Ontario, is that where you?
yes.
Yeah. So I would orthopedic footwear, and then they may require the condition.
Yes. So the diagnosis would be because of lymphedema.
Yes.
Yeah. Okay.
Yeah.
Thank you.
And it would be specifically they're being prescribed for orthopedic footwear. Yeah. And then whatever the condition is. Yeah.
Okay. Thank you.
That's a great question, Cindy. Thank you.
So, aside from lymphedema, if patients need it for like diabetic um, orthopedic footwear for diabetic offloading, or is that
Yeah.
an
So that
appropriate prescription as well?
yeah. So you would just have that as the condition, as the indication
Okay.
for use. Could be neuropathy, diabetic, diabetes, like different um,
Okay.
symptoms, depending on the symptom. But
Yeah.
yes, all of that, you would just say orthopedic footwear is and this could be just a family doctor or whomever who prescribes it.
And
But
would
that's
they
correct.
just then call your store and set up an appointment?
So we're a distributor.
Okay.
So we have a network of dealers. So they can contact us and we can refer them to a local dealer, a local vendor in their area, depending on where they live.
Would you
Um,
be able to send me, like for Toronto and the GTA, your dealers that you deal with?
on the footwear side.
Yes, because that's
Um,
always people's biggest challenge is finding a place to go to get appropriate footwear, and especially winter boots.
Okay, so I will have my team, probably Mina, reach out to you and get you that information.
Okay.
And we will. Is there an is the email you use to register? Is that the best email and contact information
Yes.
to? Okay, so we'll find that and get that for you.
Thank you.
No problem, Cindy. We'll take care of that for you. I do understand it's a challenge to know where to go and get the products and where to get properly fitted. So we'll have that for you. Any other questions? So we're gonna go calling one, calling two, calling three. Um, if there's no other questions, thank you so much, everyone, for taking the time today to learn and educate yourselves and to pass that information along to your patients and your customers. We really, really appreciate you. This is such an important topic, so we're glad to see you all here today, investing the time into learning and growing. If you do have any questions that come up later, please don't hesitate to reach out to us. We're always available. Our contact information is on this last slide. If you're interested in taking the fitter training programs, that is available too as well. Just let us know and we're happy to set you up for that. Otherwise, have a wonderful, wonderful week, and we look forward to hearing from you soon. All the best, everyone. Take care.
Goodbye, everybody.
Thanks, Franz.